Welcome, everyone, and thank you so much for joining us on yet another Friday where we have a lovely expert and a lovely conversation that can be both enriching and fulfilling for all of you who are watching. After a week long of conversations around bipolar, especially knowing that on Monday, the 30th of March is World Bipolar Day, we have been talking to experts about bipolar. And today we've got another expert explaining to us what medication conversations should be like, what patients wish they could ask their psychiatrist. So today I've got Tamsin Marlon Gray, who is a specialist psychiatrist who takes a holistic, evidence based, and collaborative approach to mental health. Her clinical interests include mindfulness, sports, psychiatry, nutrition, and lifestyle based interventions. She recently completed training in trauma sensitive mindfulness based practices through IMSA, which is the Institute of Mindfulness in South Africa, and joined the Sport and Exercise Psychiatry Special Interest Group Executive Committee. An avid strength trainer, ultra distance runner, and yoga practitioner, she remains deeply engaged in the broader fitness community and aims to give back by championing the role of movement in mental wellness. She regularly supports community initiatives, recognizing the importance of supporting, uplifting, and inspiring others. Dr. Tamsin, it's the best bio I've read so far. Thank you so much for joining us today. And we're so excited to have this conversation with you.
It's such a pleasure. Thank you for having me and for creating a platform that is so important, not just for healthcare providers, but just for the greater community.
Thank you so much. So I just want to get straight into it. We have a lot of patients who have been engaging in the Ask the Experts that we've been having all week. And I think this is a very important question when it comes to medication, knowing that it's a big and greater part of a bipolar diagnosis. And I think there's a lot of questions that they would like to explore with their psychiatrist. So what are the most important questions that you get from patients about bipolar medication?
Cool. Yeah, I mean, firstly, when patients have received the diagnosis of bipolar, it's not uncommon for the next question to be, but what now, doctor? So a lot of the time, patients will ask about what medication is used, why is it used, how long will I need to use it for, what are some of the side effects associated with medication? Is medication the only component of management? What other components are there? They often bring up, a lot of their fears around medication, particularly things that they've heard about, is it going to change who I am? Is it going to change my function? So that's kind of the first question, or not first question, but first bout of questions that we generally get. And for each of those questions, there's a very important answer too. So I know we're going to have a more follow-up question, so I'm not going to give all of those answers just yet, but in general, those are the kind of things that we do get asked, and they're important questions, so patients must ask.
Yeah. And I love that you encourage that patients should ask and they must ask once they've received that diagnosis as to what their treatment plan is going to look like, because at the end of the day, they have to administer it. And so they need to understand what it entails, what it contains, and what is excluded from it. And I think those answers coming from a psychiatrist make it so much easier to
Mhm.
deal with the diagnosis. Now, for someone who's been newly diagnosed, what is the most important thing to know about starting treatment?
So, firstly, what I think is very important to know is that if you've been given the diagnosis of bipolar, whether it's bipolar 1 or bipolar 2, it is a treatable condition. So, I also want to emphasize that it's a condition and that inherent in that, it warrants treatment. Okay, so what I always say to patients is that the treatment is quite broad, and definitely it's going to involve a component of medication, so from a biological point of view, but we mustn't also underpin the importance of the psychosocial management when it comes to bipolar as well. So there's definitely going to be an element of psychological intervention, whether that's through specific types of therapy, but there's also a social intervention as well, which speaks about involving the family, the community, and various organizations in their management. The other thing that I always also say to patients is that a very important step in the management of bipolar is accepting that this is a condition that I have. And that acceptance is really important because it's the first step to recovery.
Mm.
If you're going to fight the diagnosis and fight the treatment, it's really just going to prolong unnecessary pain, suffering, and ultimately impairment, which really can be avoided.
Yeah, I think the most important thing that you mentioned, which again helps to destigmatize or demystify, these thoughts and stereotypes that we have around bipolar, is that if you've got a condition, it's treatable, and that's where we need to start, and that's what we need to understand is, okay, so I have bipolar, and this is what I've been told I've got, and that means there's treatment, and now I need to follow a treatment plan, and that's why the questions we spoke about prior are so important because they aid in this treatment plan. So, why is then medication an important and intrinsic part of managing bipolar disorder?
So yes, you're coming to the psychiatrist who is the doctor. So of course I am gonna speak quite a little bit about medication, but I come back to, the question that you asked before and just emphasizing that it is a condition. So there are neurochemical and neurobiological mechanisms at play. So what I mean by that is that there is systems in the brain where we see things are not functioning in the typical way. So depending on where you studied or that avenue that you want to follow, a lot of people speak about the inherent pathology or changes, is what I'm going to say, rather, in the rhythmicity of the brain. So there's changes in how the brain perceives mood, cognition, and sleep being a big one. But there's also a basis for understanding that there's more to that as well. There are biological or chemical mechanisms at play. There's the concept of neuroinflammation also at play. And there's a whole bunch of also very, very nuanced, almost messenger systems in the brain that are at play when we look at the diagnosis of bipolar. So because of this, medication is really important. Medication plays a large role in targeting all of these various mechanisms involved in the symptoms that we see when it comes to bipolar, and particularly in those relating to mood, relating to sleep, relating to energy, relating
Mm.
to decision making. So a lot of the time, we have to target our medication at those symptoms, and it's quite hard to treat without medication. It's almost, I don't want to say impossible because nothing is impossible, but bipolar in particular is one of those conditions where medication is definitely a cornerstone of management.
Sure. I think from that response, it makes it so important and emphasizes the need to really speak to your psychiatrist, to open up about your fears, and to get an understanding as to what this medication is doing.
Mm.
Because I think a lot of the times people say, well, I was just given this medication and I was told how many times a day to take it, but I don't know what the dosage means. I don't know what medication I'm taking. I don't know what it regulates. And so I fear that if I stop the medication, something might happen, or I'm just going to stop the medication because I can't deal with the effects. So I think this is so intrinsic and so important to have the description that you've now just provided to a patient who has now been diagnosed with bipolar and has to start the journey of a treatment plan that includes medication. It makes it so much easier to follow a treatment plan and to know that this treatment plan is beneficial because it has been explained as to what bipolar looks like and why the medication is so important. So I think that's really, really nice, Dr. Thompson. Now, I just want to get into the common question that people ask is how long does it usually take for the medication to start working?
Sure, this is very much also quite patient specific or specific, sorry. So the answer I'm going to give is quite generic, but I just want to say to everyone listening and to patients as well, and also to other healthcare providers that might be listening to our little show today, but it is very much patient specific. So it also is going to depend a lot on the type of bipolar that we are treating. Remember, I said to you that there's a bipolar 1 and there's a bipolar 2. It's also going to depend a lot on what kind of episode we are treating. Is this a depressive episode? Is this a manic episode? And it's also going to depend on whether or not this is the first presentation or a subsequent multiple presentation. So it is very specific to each individual, but essentially what we hope to see is a degree of response within a few weeks if it's an acute episode. But if it is a bit more of a longer episode and it's not the first episode, it can take more than a few weeks, can take sometimes months. And it is really important that everyone involved in this person's life and in their management is aware of that, because it's not like treating the cold or treating a UTI or treating a broken finger. It's very different. Our treatment takes longer before we start to see effects, and it's going to warrant a lot of patience on everyone's part and a lot of compassion and support. So it's it's not as simple as I'm taking this medication tomorrow, I'm going to feel better. It's a journey, and it's important that everyone just supports each other on that journey.
Yeah. And to echo that, I think you mentioned that when you start this journey, you need a lot of patience because things are not going to move as quickly as we would like them to. And I'd just like to tie this into the question around side effects. A lot of people worry about side effects and they think, I don't want to have to experience side effects because a friend of mine took bipolar medication and that didn't treat them well. So, what should patients realistically expect around side effects?
Yeah, side effects are a warranted concern. So, the first thing I would always say to patients is you can't base what you think your experience is going to be off of another. So everyone responds to medication quite differently. Again, I come back to it's really important to have more individualized care, because there's so many factors at play when it comes to medication, how it works and side effects. There's genetic factors, there's environmental factors, there's even, we can go as far as to medication production factors. So to purely base what you think your experience is going to be off of that of another, I would say to you rather just take a step back and let's understand genetically, maybe have you got a family member that's been on medication before? What medication have they been on? Has it worked for them? What hasn't worked? What side effects have they had? Because that is more informed from a
Mm,
genetic point of view. But what I also always say to patients is, we can cross a bridge when a side effect appears. It's really
mm,
important to talk about it, to bring it up so that we can actually address it. And if there
yeah.
are side effects, there are things that we can do. We can look at reducing the dosage of medication, for example, depending on what the side effect is, or we can look at changing you to another kind of medication where that side effect might not be as common, or sometimes if we are limited in the options of medication that we have, we need to sometimes add an additional medication to circumvent or treat a side effect that's come up. But it really then becomes a situation where we need to look at the risks versus the benefits. There's a lot more risks not being on medication and sustained than rather treating the side effect or adjusting the treatment plan where you are still functional and not suffering and not in pain. So I
Yeah.
always, I always bring that up to patients and say the very first step is talking about it, noting what the side effects are, being actually quite specific. So sometimes I also say to patients, I personally love it when you come and you bring like a little diary of what your experience is and you say, okay, I've been having this side effect. So keeping a log of what you're noticing because we're not with you 24/7. So it's important that you are also very aware of what it is that you experience so that you can talk about it because that's ultimately the first step.
Sure. I think that's important. It's an important sort of place to get to as a patient, where you realize I actually need to create common ground with myself, and I need to meet myself halfway, where I understand that I there's risks and there's benefits, and there are far greater risks in not taking medication and potentially not getting better. Then there are side effects. And so, working with a psychiatrist, it's easy to mitigate those side effects or to lessen their severity, which I think is important. So it's a warranted worry, like you said, but it's also one that you can have a conversation with your psychiatrist about. Now, I want to tie two questions together. What should someone do if they feel like their medication isn't working and they're perhaps thinking maybe I should just stop taking my medication? And then what is the risk of suddenly stopping your medication?
This is such an important question, and I'm so glad that we are asking it on this platform. So the first step, like I said, previously, is to talk about it. So
Hmm.
I always encourage patients. I mean, the first time I prescribe medication, I obviously counsel patients on potential side effects, and I always say, please, please, please be aware of this, and if it happens, talk about it. Because as clinicians, as healthcare providers, we can't do anything if we don't know. So maybe we could observe some of the side effects that are reported. So I'm just going to give an example of like a tremor. So we could see the patient and they have a little bit of a shake in the session. So we can notice that. But if it's a bit more of a subtle side effect, it's going to rely on you talking about it. And it should feel safe enough to do that. Your clinician, your healthcare provider is there to help you, not fight with you. I
Yeah.
mean, we are bound by our ethical principles of doing no harm and acting in the best interests of our patients. And part of that, doing no harm and acting in best interests, is addressing side effects. So that's the first thing I would always say is don't just stop your medication, talk about it first, about what's happening, keep a log of what's happening, and then really just try to work collaboratively with your healthcare provider that is prescribing that medication to address those side effects. If the healthcare provider is also now reaching a point where they're like, okay, this is not within my scope of practice, I'm also going to say to the healthcare provider and to the patient, it's really important at that point to say, okay, let's then make sure that you are seen by a specialist who can evaluate for this and take the next step. So that's on the one hand. The second question that you asked was around suddenly stopping medication. So I would really, really discourage people from doing this because what can happen is if you suddenly stop your medication, you can actually have what we term in the medical field a relapse. So what I mean is you can actually develop another episode. So a depressive or manic or hypomanic episode. And often these episodes, so subsequent episodes, are more severe and they become harder to treat. So the more you interrupt treatment, the longer your duration of illness or impairment, and the harder it becomes to treat. So actually what ends up happening is instead of maybe just being on a mood stabilizer, for example, we're needing to add additional medication for management because it's becoming harder and harder to treat. Another important thing that can also happen is if you suddenly stop your medication, you can experience discontinuation symptoms. So, this is not to say that you're addicted to the medication. No.
Mm,
Remembering that bipolar is a neurochemical, a neurobiological condition. So, that chemistry has now adapted to the medication. And if you suddenly just take it away, it's like suddenly not putting petrol in your car. Your car's not going to work. So it's the same kind of concept in bipolar that if you suddenly just stop your medication, the car's not going to start, it's not going to drive, it's not going to go anywhere. And actually, when you put petrol then back in the car, it might not also start again automatically because some of the symptoms that you've also had become heightened in the absence of treatment. So they're actually worse.
yeah.
So, in a nutshell, to answer that question, I would really, really say to patients, please, please, please talk. You know, psychiatrists, mental health care providers, we really are in a field where we want people talking. So please talk about what's happening and don't just stop.
Mm. I mean, that's a wealth of knowledge and a number of things that we can also apply in the call center when we sort of encourage patients to not stop taking their medication, but to actually talk to their psychiatrist. But what I appreciate the most, Dr. Tamsin, is how you explained it and how you put it forth for a patient or whoever is watching this episode of Ask the Expert. It was very compassionate and it was very kind. And I think it mimics and it mirrors what that conversation will look like with their psychiatrist if they bring it forth to speak about their medication and why they feel it's not working and why they feel they might be due for a change. So we really appreciate that because then again, it helps us to tell patients that there really is a person who's willing to listen to you. And that first person is your psychiatrist. And that's so important. And I think just to sort of sum this beautiful episode up, I would like to ask, how can family or loved ones or support systems help to support someone who is on bipolar medication? What is their role in that lifestyle change?
Such an important question again, you know, and kind of it ties in a bit with when we were discussing management of bipolar. I come back to bipolar being treated in a way where we look at biological, we look at psychological, and we look at social. So the family is very much the social component of managing bipolar. So, what I would always say to family members is it's really important that you are there for your family member who has a diagnosis of bipolar and being there in a capacity of non judgment, but rather in a capacity, I mean, well, not being in a not being judgmental is what I meant, sorry, but being there rather in a capacity of support, love, compassion. And it is a journey for the whole family unit. Besides for the person who has bipolar, the families are often also very much affected by this diagnosis. And at times it can feel very helpless or hopeless because, again, it's the individual that has the condition, and a lot of the times it is dependent on them seeking treatment that they need. But as family members, there are ways that you can show support. So, what I always say is it's about not fighting the person for having the condition. They have a condition. Their condition
Mm,
doesn't define who they are. And what you as a family member can do is you can just make sure that you yourself are informed about what bipolar is. So getting psychoeducation about the diagnosis and its treatment, but then also just making sure that just checking in curiously, kindly. Have they been taking their medication? Are they attending their appointments? And routine is so important in patients with bipolar. So, as much as possible, can the family unit keep a consistent routine so that the person who has the condition is kept stable?
Yeah,
And it's not entirely out of their control as well. There's elements in management that they do have control over, and it's just about making sure that they utilize those so that everyone feels supported.
sure. I think that's again a really nice and kind and compassionate way to sort of help the family as well engage in this new lifestyle change. And like you said, it is for everyone, so it's not just vicarious, but we're all in the same pool, and therefore we need to sort of help this person who's you've received a diagnosis and is taking a bipolar medication. One last question to wrap all of this up. What message would you like to leave with people who feel unsure or afraid of taking their bipolar medication?
So the one message, well, there's more than one message, but the big thing is that I think it's really important that everyone is aware that it's a condition. It doesn't define who you are. It
Mm,
just means that adjustments need to be made in the way that you're managing your life. Okay.
mm,
And medication is just one of those components of management. There are other nuanced areas of management too. Like I've touched on a little bit about lifestyle, I've touched a little bit on about the support from the family, I've touched a little bit on the psychological management as well. But
yeah.
just touching a little bit on the medication, what's really important to know is that your medication is not supposed to change you. It's not supposed to make you a zombie, and it's not making you an addict.
Mm,
It's there as a component of your management so that you are able to live a life without pain, suffering, or impairment, and that you are able to really just embrace the journey that you find yourself in.
mm,
So, my take home message mostly would be about, yeah, it comes back to that acceptance, but accepting with kindness, compassion, and patience with this is a part of who I am, but it doesn't define who I am.
sure. What a beautiful, insightful, and encouraging session, Dr. Tamsin. I really, really appreciate having you here and opening up so, again, compassionately, but very, very transparently about medication around bipolar and providing that education in a very calm, very kind way. Thank you so much for making the time to be here today. And I know that a lot of viewers are going to benefit from this session.
It's such a pleasure. And yeah, thank you for having me and thank you for having these kind of conversations. They're so, so important. And I think the more that we talk about them, also the more we help. So
Yeah.
keep them
Yeah.
coming.
Yeah, the easier it gets to treat these conditions. Thank you so much, Dr. Tanton, and thank you to all of you for joining this session today. If you would like to see a lot of these sessions, please stay tuned on our Facebook, our Instagram, so that you can see another Ask the Expert session again on Friday, where we talk to another expert about something that is a burning question. Thank you so much for having us today, and have a great one.
Bye.
Bye.